If you ask me, well, what was the turning point? What really changed the response that occurred, from not so much from MSF standpoint, because we were very early on involved in responding to the epidemic, but more the global community and the global healthcare community, but also governments globally. What was the real tipping point? And really, when things changed was in July 2014, when a U.S. physician tested positive for Ebola and was evacuated for treatment. And then additionally, the first patient who was diagnosed outside of Africa and was treated in Dallas, Texas in August in 2014, and unfortunately the latter of those two succumbed to the disease. But the transition of Ebola from a humanitarian crisis in 4 countries in West Africa to a potential security threat here in the developed world is really when an appropriate scale response was then mounted, and reaction, both in terms of resources, personnel, technology, came into the fore to be able to address the issue. And so, the question that I would sort of then, throw out to you is, well, what is our responsibility or obligation to respond to healthcare crises of this sort? And going back to the one slide that I presented and talking about a responsibility for people all over the world to be able to achieve the highest attainable state of health care, what does that mean? How do we interpret that? So is the highest attainable state of health care, does that refer to what we in the U.S., or since we're all here in the Boston area right now, what we could get at one of the Harvard teaching hospitals, which we might think of as about as high a quality as one could encounter? And is it reasonable then that somebody who lives in Sierra Leone would be experiencing health care at a different level? Or is that something that's more of a country-based and each individual nation is responsible for looking after their own? Or is there some playing field that should be leveled across the board in that regard in terms of the quality of health care?
Hi, my name is Alejandra. I'm from Ecuador. And I was just wondering, have you ever had a specific patient, or have you ever been in a specific situation which made you question your medical career?
If I'm understanding the question properly, if you're asking, has there been a time, an event where I said, oh my gosh, I made a mistake going into healthcare, what was I thinking, or words to that effect, I would say no, I can't think. So hopefully that reassures people in the room here who are thinking about healthcare as a career. But while there have been at times patients that have been challenging or maybe frustrating or even discouraging in terms of maybe not being able to do what I would want to, or maybe they've been non-cooperative in terms of their response to recommendations or treatment that I've been trying to achieve, I would still say that in spite of that, it's really been a wonderful privilege to be able to be in the medical profession. I couldn't more strongly encourage you as a group or you as an individual to say, yes, there may be some difficult patients, but by all means, stick with it, and because at the end of the day, for those of you who wind up going into it, I think there's the potential for all of you to be tremendously rewarded and satisfied by what you're doing.
My name is Roy. I'm from Massachusetts, and I'd like to ask, how are you normally treated by the patients that you're treating?
I can't give you an exact number of the countries I've worked in around the world here now over the years, but I'll bet it's probably been in 40 different places is what I'm going to say. And uniformly, everybody appreciates a conscientious and caring and compassionate healthcare provider. So there's nowhere in the world that you're not going to be welcomed if that's the intent and the mode that you're operating under. And again, that just sort of speaks to the I think I would say the beauty of the discipline is that we're a valued entity wherever we go, provided that we are respectful and kind of providing a quality and a service to patients in need. And so it's very quickly appreciated. You don't have to be familiar in an environment to be valued, is what I would say. Again, I just think that it's been a great honor to speak to you as a group. You've got tremendous futures, I think, ahead of you, and boundless opportunities. And Again, I just wanted to thank you for your time, your presence, your energy, and your great questions.